Hello and welcome to the Health and Care Hustings for the leadership election. I'm Dr. Mohsin Khan. I'm a practicing doctor and I'm also a directly elected member of the Federal Policy Committee. Just to give a bit of an outline as to how these hustings will work, I'll give a brief introduction to topics of health and social care. We'll then hear from our two leadership candidates. They'll give 3-minute opening statements. We'll go with Ed first and then Layla. And then at the end, we'll have 2-minute closing statements. Layla first and then Ed. The bulk of the session is us going through various questions, loosely grouped into 5 or so different areas of topic. We've had questions in from members. Feel free to enter questions in the chat on the YouTube. My aides will be sending that through to us. Unfortunately, we don't have a BSL interpreter here today due to a technical problem there, so we give our apologies for that. So just to start off, health and social care is clearly up everyone's agenda today. The COVID pandemic has highlighted both the strengths of our current system, the organisations, the staff, the plans, but also the weaknesses, and has highlighted what more needs to be done. In our party, we know that our leaders don't make policy, that's the members, but they do set the climate in which we make policy. They have great influence over policy priorities, particularly in an area like health and social care, where the area is so huge, it touches on so many other areas of public policy: taxation, public spending, and personal responsibility. So just to start off, we're just going to start off with the opening statements now of roughly 3 minutes. Ed, if you could start, please.
Thanks, Mohsin. Friends, the NHS has played a critical role in our country's life ever since the great Liberal Beveridge saw his wartime plan enacted by the 1945 Labour government. And during COVID, the importance of our NHS has never been more clear, and people's support for the NHS has rarely been stronger. Throughout this campaign, I've made clear I want us to campaign on issues that matter most to voters. The NHS is central to that. From prioritising investment through our penny on income tax for the NHS and social care, to tackling issues other parties have neglected, like mental health. In my constituency over 20 years, I've led numerous successful NHS campaigns, and I want our campaigners across the country in target councils and constituencies to be their local NHS champions. It's a winning target seat formula. But as a national party, we must offer something distinctive and different from the others. Here's my plan. First, COVID. Our health and social care spokesperson, Munira Wilson, has been brilliant in exposing the government's multiple failings on test, trace and isolate, on PPE, on the care homes. And I've led our campaign for an independent inquiry into the government's shambolic handling of COVID. When I secured a public commitment from Boris Johnson for that independent inquiry, the media went wild, as they could see it was a significant moment and a major victory. If I'm leader, holding Johnson to that formal inquiry promise will remain a key objective, given we have won such a distinctive position on it. The second area where I believe Liberal Democrats can be distinctive is care. Anyone following my campaign will know that from the start, I've made care one of my 3 priorities. I've long thought our party could be distinctive on care, and with my own personal lifetime experience of care, this is something I can talk about with some understanding and passion. COVID has simply confirmed my strategic thinking for our party to make care a priority. People now understand better than ever the close links between social care and the NHS. When Boris Johnson said, "Protect our NHS," no one disagreed. But now everyone knows he forgot the care homes and betrayed vulnerable people in our care homes, betrayed their families, betrayed care workers. So I want us to campaign for a better deal for social care, centred on a better deal for carers. I want us to be the voice of Britain's 10 million carers. Given only 3 million people voted for us at the last election, it might even help us win. Friends, let our party speak again to voters' top concerns. Let us be the champion, not just of the NHS, but of Britain's carers too. Thank you.
Thank you, Ed. Leila?
Thank you, Mohsen. Thank you all for watching this afternoon. COVID-19 has undoubtedly exposed the deep inequalities that run through our society. During the pandemic, our heroic carers, doctors and nurses have risked their lives for others. Mental health workers have provided remote support to many of the most vulnerable people in our communities, and our emergency services workers have continued working with often little resource and even less time. But they did this not just in the face of ministerial failures to properly plan for and indeed react to this coronavirus pandemic, but also in the wake of austerity, decades of constant top-down reforms, and an inability to reach a long-term settlement on social care. To create and maintain health and care services fit for the 21st century, it's clear that this country desperately needs the same liberal ideas that helped to found the NHS in the 20th century. I support our party's call for a penny on income tax to shore up the immediate gap in social care funding. But we are right to be calling for a sustainable plan for the long term too. As part of my vision for the country, I have championed making well-being a key measure of how we monitor the health of our economy. We need to ensure services are patient-led and welcoming to all. And vitally, we need to fight against ever-increasing privatization and maintain the core principle of being able to use the NHS free at the point of use. Hands off our NHS, Trump. But to change our country, we have to recognize that we first need to change our party. We need to win more seats on local councils, win more seats in the devolved institutions and at Westminster too. And unless we do, we can't bring about the change that we need. And that is why I am standing to be leader. I want to show people that we can achieve change from the position that we are now, not in some fictitious government of the future or harking back to a time of the past. And I have a track record of doing this. Over the last few months in Parliament, I've secured the creation of the Coronavirus Compensation Scheme, which provides support for the bereaved families of NHS workers who have sadly passed away. I am leading the cross-party inquiry into coronavirus, into this government's shambolic response to the pandemic, so that we can learn the lessons before a second wave. I've shown that I'm someone who takes concrete action now to make the country better. And this is what I want the Lib Dems to be. There has never been a more important time for a revived Liberal Democrat Party. We need to seize this moment to move our party and our country forward together. And I hope you'll join me. Thank you.
Thank you. So now I'm just going to ask some questions on top messages at the doorstep, because we know that campaigning is what helps win Lib Dem seats. It's what makes the Lib Dems Lib Dems. So my first question to you, Leila, is what would your top 3 messages on the doorstep be on health and social care?
Thank you. So the first one, which I alluded to in the opening statement, is actually we need to make sure that people can see that we've got a credible plan for this and that we understand that it does need more money. But what people don't like and what loses you credibility is when you keep calling for things that cost more money and then you don't have a plan. So that is why I love the penny on the pound on income tax for the NHS and social care, because actually it's speaking to something that I think is deeper running in the problems we have as a party. The problem is that people don't trust us anymore. And so when we say we want to tax you, we're going to increase general taxation to pay for the NHS and social care funding gap that we have right now. But actually, I would also argue that many people would accept an even higher general tax rise if it was hypothecated in that way. Then actually that goes down really, really well. So I'd start there. But the second thing that I think we have to continue to talk about is well-being, and a critical part of that, a distinctive thing that we have already carved out as a party, and I don't think we should stop this, is mental health. So many people are being affected in their mental health in this coronavirus pandemic, and to talk about it now is an incredibly pertinent thing to start talking about, but it's also quite distinctive. There is no other party that is doing it quite in the same way that we are. And the third area that I want us to be talking more about is a more general approach to prevention. Recognizing in that very liberal way that we do, that actually the key to solving a lot of society's problems is to recognize that there isn't a one-size-fits-all approach, that actually the best thing that we can do is to empower individuals to take care of their own health. And often that means better education. It means better access to primary services. It means they themselves will have the power and the knowledge to be able to make those positive choices. People are living longer, which is fantastic, but actually society has not adapted to a population that is living longer. And by introducing ways that older people, for example, can take more exercise, can realize that you can have very healthy lives in your 70s and 80s, that would be transformative to the rest of society. So funding, mental health, and prevention.
Thank you. Ed?
Mosin, 2 out of my 3 are the same as Layla's. I'll explain the third difference. The 2 that are the same are the money and mental health. It seems to me we have led the argument on hypothecation. When I was the party's economics advisor back in between 1989-93, I developed the policy of a penny on income tax for education. And that was our most cut-through policy in the 92 election, the 97 election, the 2001 election. And when Tim Farron persuaded the party to adopt the penny on income tax, but for health and social care, ahead of the 2017 election, I was absolutely delighted. He picked the right priority in the right way of getting the message cut through. So I absolutely back that. And I would say to our canvassers on the doorstep, make sure you stress the social care element of that penny. I then go on to mental health because, as Layla said, is absolutely critical. I think people forget how many people are affected either directly or indirectly by mental health at some stage in their life. And we have a great track record. In the coalition, Norman Lamb did such a fantastic job, and we can talk proudly of a really good record and then talk about how we'd use that extra money to invest in mental health services. Now, the third thing is I would say it should be a local issue. I think if you go on any doorstep I've been on and just give them national policy, they'll look at you a bit odd. You've got to have a local element, whether it's about the local hospital, the local health centre, local dentist, local ambulance, it doesn't really matter. But any Liberal Democrat campaigner worth their salt will know what the local health priority issue is. It will be in the literature, I would hope, and they would focus in on that. And I would really urge campaigners on doorsteps to make sure you always have a local dimension to your campaign messages, particularly with health and social care.
And my next question, just following on from the top 3 messages on the doorstep, would you have any different messages or any additional messages for health and social care staff? So to start off with, Ed.
Well, I think, first of all, thank them. They've been thanked a lot, quite rightly. And I think if you're on the doorstep and you find someone as a nurse or a doctor, consultant, a care worker, thank them. That's the first thing. And the second thing, I think you talk, depending whether it's health or care worker, about our package to them. So in the NHS, I think they'd like to know about our penny on income tax. I think they would value that. They value that we were a party putting our money where our mouth was. But I'd like to actually focus on care workers, because we haven't actually in the past very much, and I want to change that. I want us to have a policy where we will put paying conditions for care workers on a parity with equal workers in the NHS. Now, I know that's complicated because the social care sector has a lot of private sector providers, has local authority providers, has not-for-profit providers. So it's more complicated. But I think that should be our vision and our target, because I have been, well, I've always known, but I've been particularly shocked during COVID about the poor paying conditions of care workers. I think people want that changed. I bet you bottom dollar care workers want that changed. And I think if we're going to build a fairer society post-COVID, we need to start with those care workers who've given so much and suffered so much and worked so hard. And I think people would want us to put them on a parity with NHS, and it follows through with our focus on care, which I'm talking about, and with our long-term policy of integrating NHS and social care.
Thank you. Layla?
Well, I'm reminded in this question of when coronavirus was at its peak, and every Thursday we would go out and clap for NHS and frontline workers. And one of my neighbours just down the road would always come out and start chanting, "Pay rise now, pay rise now, pay rise now." And at the time, and it went on for weeks and weeks and weeks, and the assumption, and I'm glad he was doing it, and the assumption was that at the end of all of this, when they started to announce pay rises, when they were thinking about the workforce, that it would be for everybody and it would be substantial. And unfortunately, that is just not what we've seen. And instead, what we've seen is Rishi Sunak say to all departments, well, we are potentially entering another period of austerity. And the first thing that people in government look at when they are approaching periods of austerity are public sector pay, and it's just not good enough. So pay, and paying them properly for the incredible work that they do, isn't just the right thing to say to a health and social care worker. It's actually a very popular thing to be saying on doorsteps. But with that pay also comes the conditions, the long hours, the stress, the lack of mental health support, the presenteeism that we see in our health and social care workforce. And this is particularly true in social care that is so often undervalued. And all of these things apply, but even worse very often, to that sector. So the third area is that mental health aspect, is ensuring that, particularly in the wake of coronavirus, that the trauma that many of our health and social care workers have gone through, things that I am taking evidence on when I spoke to the BMA in the inquiry on coronavirus, this was a few weeks ago, this came out loud and clear. And we're also starting to see the impacts of this, particularly on minority groups. We're seeing doctors from Muslim backgrounds who are being told that they have to shave their beards in order to wear the right PPE, or they risk not being able to be on the front line where they deserve to be. And that's a fault of the NHS, that's not the fault of them. We're seeing hospitals start to convert unused rooms and wards that they can't use right now into mental health and well-being centres, which is fantastic. But then it also begs the question, why is that necessary? And it's because there has been a chronic lack of support and a chronic lack of staffing in the first place, all made worse by Brexit. So 3 things there: pay, conditions, and mental health.
Thank you. So we're getting quite a few questions just around the topic of home carers, and also on the area of which parts of the care workforce you might focus certain pay rises or other substantial funding commitments. So I'm just going to ask about that, home carers, and which parts of the workforce in the care area you might focus policy commitments on. So if I start with Layla.
So on home carers, I mean, the vast majority of carers in this country actually aren't paid. They're unpaid carers, and this could also equally apply to women who are taking care of young children disproportionately. We're seeing through coronavirus that it's disproportionately those people who are taking care of others who are far more likely to be on furlough, because it's the only way that they have been able to manage working from home with the demands of everything else. And we know that there are also huge numbers of young carers, and I'm really proud of the Young Liberals motion that has gone through, that has raised this issue, written by someone who's got experience of this. And in my own area, I support a local young carers charity called Be Free Young Carers. And one of the issues they face is that while there's a statutory obligation on the council to do an assessment of the needs of that young person, there is then no statutory obligation to actually follow through to make sure that the money is there to deliver on what they have assessed. It's utterly perverse. And all of these things desperately need to change. But unpaid carers are one, and the concrete action that we need to change there is that I would not just increase carers allowance, but also lower the bar for who can get carers allowances. There are all sorts of things in the system, like you can't work above a certain number of hours, you can't share the load with others in a household. The combination of these means that the burden ends up falling disproportionately often on 1 or 2 people's shoulders, and it causes untold harm. And the second is young carers.
Thanks. Ed?
Well, certainly, I agree on unpaid carers. There are many millions of them. They are mainly women, and for years and years, we have never recognised them properly. Carers allowance is something that I've been talking about a lot in my New Deal for Carers, an increase in that. But actually, long term, one of the reasons I support a universal basic income is because that will mainly benefit carers and therefore women. They're the biggest category of beneficiaries. And one of the great things about doing it through universal basic income is that all the eligibility criteria around a carer's allowance would not apply. And therefore you would get it to everyone, including young carers. As a young carer myself, my father died when I was 4, and I looked after my mother when she was terminally ill between 12 and 15. Young carers are a massive issue for me, and we need to support them. But there's another group of home carers that I think we need to think about in this, and that's domiciliary care workers. There are probably hundreds of thousands, actually, certainly tens of thousands of people going to other people's homes every day, mainly elderly people, but some disabled people, people with mental health problems. Actually, we have a carer coming to our home because of my disabled son. And those domiciliary care workers play a critical role. And some of them have suffered along with the care home workers. And I think if we're going to do a proper package on care, we've got to think about the unpaid care workers, we've got to think about the care home workers. We must not forget the domiciliary care workers. They're absolutely critical. There's very many of them, and they are deeply underpaid. And I think they're some of the most exploited of care workers in our society today. We've had the arguments about them having to include their travel time as part of their wage, not like many other people, and that's really sometimes reduced their pay. And there's been lots of work on that by councils and by the Low Pay Commission, and that really needs to be tackled. So this will come at a price, by the way, friends, but I think it's the price we should be prepared to look at and to deliver, because we're not going to get a fair society. We're not going to get better care unless we treat all care workers, unpaid, care home and domiciliary care workers, properly.
Thanks. So now I'm just going to move on to the topic of broader social care funding. There's increased consensus from both the left and the right that we need to really pay for a certain level of personal social care for everyone, so it's free at the point of use, likely out of proceeds from general taxation. So what I'd like to ask is, where would you stand on that? Would you have any views on what level of personal care should be funded as a minimum level? Should that be universal coverage? And in terms of how we fund that, where should those taxes fall? And what type of taxes should they be? So if I can start with Layla, please.
Listen, I'm smiling because actually I reckon that you could run a day's conference on the questions that you've just asked. So I'll do my very best, but bluntly, I think that what we should be going back to is what the principles behind all this have been looked at some depth, and the Dilnot report, I think, really encapsulated a lot of it. And yes, there should be a pooling of the risk, which is absolutely the right thing to do. The more I speak to my own constituents about this, the more appetite there is for much of this money to come out of general taxation. One of the things that we certainly learned from the 2017 general election is that in no way should anyone's primary home have to be sold in order to pay for this. There is something deeply offensive about that, and I can understand it. And so we have to keep away from that. And the Dilnot Commission itself suggested that the cap should be somewhere between 25 and £50,000 as a lifetime cap. I know that that sort of rose a bit when it was then taken into Whitehall, but I wouldn't want to put an exact figure on it because I do think that the details of this will matter. But that is the kind of order that I think we should be looking at, a kind of level that actually most people who have the money should be able to pay, and still be able to pass on the majority of their assets to subsequent generations. But there should also be provision in there for those who are unable to pay for that at all, to have high quality care. But the last thing I'll say, and I think this is the most important part of it all, is that it needs to be integrated. It has to be something that is available to everybody. There shouldn't be a postcode lottery. It should have a minimum standard. And the best thing that we can do is to devolve this to local areas and give them that power. And yes, there will have to be general taxation money that is fed into it. But I strongly believe that more democratic accountability in this area and a higher level of political will to make this happen is what's needed. And actually what I want now is for the government to just get on with it. They have made a promise that they are going to do this. Simon Stevens said this could be the one good thing that comes out of coronavirus. I hope there's more than just this, but I will certainly as leader be working to make sure that this happens in this parliament.
Thanks. Ed?
Mosin, certainly we need to pay through general taxation for social care. And I think the Dilnot Commission is absolutely the right starting place. And it's the right starting place because it takes the principles of the NHS of pooling risk. And that simply says that in health, you don't know if you're going to be the person who gets the disease that requires huge amounts of expenditure. So we pool the risk about that. And equally in care, you don't know if you're going to be the 1 in 6 person, 1 in 7 person who needs dementia care for 20, 30 years. And so as a society, it's the most efficient way to pool that risk. So we work together. And I think that as an underlying principle of fairness, and it builds on the principle of the liberal principle behind the NHS. So absolutely, that's the right way. There is a debate on what the cost of care, the cap on the individual's contribution should be. There's been a big debate about that. The party needs to debate where that could be. Whether it's 20,000, 50,000, whatever it may be, we do need that debate. The one good thing about having a cap like that is it does enable people to make some provision for themselves, particularly the better off, and that's as it should be. In terms of what general taxes should rise, I mean, I spent a long time costing the manifesto that we fought on, and I've need costs of manifestos in the past. And there's a huge number of tax loopholes of taxes that the wealthy managed to escape and that big business managed to escape. So I can't see fundamentally a problem. Some reforms of the capital gains tax, reforms of corporation tax, you can find the sorts of money that would be needed on an ongoing basis. So I don't think we should shy away from saying general taxation on a fair basis is fundamentally the way to pay for this. But I'll say this as a final point, which might worry some. Sorting out the cost of care for the elderly, people with dementia, is only the first part of the puzzle, the first part of the social problem. There is a very big care cost, which people are not talking about. And it's the cost falling on local authorities of providing care for adults who are of working age, but because of disabilities, learning disabilities, mental health problems, are unable to work. Some of them live with their families, some of them don't have families to live with and need residential care and support. And this cohort has been increasing significantly in our population. And it's been described to me by more than one director of social services at local authorities as the burning platform of care costs, which no one talks about. And I want our party to be the party that tells the truth on care. Like I want us to be the party that tells the truth on climate change. Let's have some truth telling on care. There's some massive changes that we need. It's not going to be cheap and we need to face up to it. If they won't, we must.
Okay, thank you. So just to push both of you a bit on this area, just in terms of funding for it, in terms of Lib Dems, we've got our historic commitments around income tax rise, around hypothecated tax. Would you have any more specific views on what taxes might need to rise in order to really put money into social care? Just because this is an area that we've had quite a few questions asking about, where should that tax burden really fall? Should it be on retirees? Should it be on working age adults? How would you square that particular circle? So if I start with Leila first.
Well, on this specific point, actually, I don't have a specific formula, and I don't think it's right that I do. I think it is right that as a leader of the party, that what you say is that you want it to be progressive. You do generally want those with the broadest shoulders to shoulder that burden. That's the right thing to do. That's the liberal thing to do. And if you are someone who falls in and out of circumstances whereby at the moment that you need that help the most, the liberal principle is that the state at that point will catch you when you fall. And the job of the state, in my view, is to ensure that there is proper planning for this. And one of the things that is coming down the line is an economy that has more and more people who are older in it. Now, that's fantastic. But it does mean that there is potentially going to be more need for a social care system that is robust. But at the same time, the Tories seem to be squaring this with an immigration system that is positively freezing out the very young people that are coming to support not just those people who need the carers in the homes, but actually the economy as a whole. And it's a completely reverse way of looking at it. So what I would like to see is a series of taxes that essentially make sure that that wealth is distributed as much as possible. And we have so many different policies around this. I do think some of those is helpful to be hypothecated, particularly if there's income tax rises, and those income tax rises I would support. I would also support rises in corporation tax, and I would also support cuts to the benefits that some of the most wealthy get at the moment. There are over 1,000 different tax loopholes that could be closed at the moment for the highest income tax bearers in the country. So there's a lot of them, but I do think that's a specific question for not just the party, but also for those writing the manifesto at the next election.
Thank you. Ed?
Well, I want the party to take a serious strategic look at all aspects of spending and how we raise the money when it comes to care. As I said in my last answer, it's not just about care for the elderly, it's about care for adults of working age who can't work. It's also about funding the rises in pay that we've talked about for care workers. It's also about funding how we support unpaid care. So there's a big bill here, and we should be honest about it. Can't just say that it's, it's small, it's minor. It's going to be a big bill, and it will have to be introduced over time. So the question is, where can it come from? It's not going to come from just one tax. It's clearly going to come from a number. We need to make sure in this sort of discussion that we're focused on the right principles. So progressivity and fairness is absolutely critical. The idea, however, that it can just fall on just a few people or a few companies, I'm afraid that's a myth. There's going to have to be some broader based taxes as well. But I also think when we come to these longer term tax questions, alongside these longer term spending questions, we need to have some real deep radical thought about where the tax system is going. Let me just give you one example, or two actually, about what I'm meaning. First of all, if you're looking at a greening economy, the taxes that we've hitherto got from fossil fuels, they're really going to go down, aren't they? Because we're going to get rid of fossil fuels. So there's going to be a hole there. What do you do in a green economy, which is what we absolutely want, but we'll be phasing out those fossil fuel taxes. Equally, because so much economic activity is digital these days, particularly through some very large monopolies, often big American tech, how do we make sure that those companies who are earning vast profits, whereas some of the smaller companies who have got shops, have got business premises, are non-digital, that they don't pay an unfair share? So the reason, Mojin, when I give you that sort of, you might think it's slightly off-piste, but it's absolutely relevant, because when you're talking about big changes in tax burdens, big changes in spending directions, you've got to look at the wider piece. And my background as an economist, I've got a degree in economics and a postgraduate from night school in economics, teaches me that you can't just silo one piece of spending or tax. You've got to look at the broad picture. And when you're talking about long-term trends, and this is a long-term change, you've got to address some of those wider issues. So I would want the party to tackle it in that way, in a much more profound, strategic way. It would be more radical, but I think it's the right way to do it.
Thanks. So Ryan Campbell has asked a question about end-of-life care, and he asks, should end-of-life care be moved within the NHS as opposed to having the charities stay outside of the NHS sector? So Layla, if you could start off with that, please.
Well, my first principle there is, bluntly, everyone should have the right to be able to die with dignity, whatever that means for them. And I do support moves to change the law on assisted dying, but actually I don't just mean that. What I also mean is that those who are coming to the end of life have real choice about how they spend that time, and they do it in a way that is sensitive to their needs. And it's a huge range of need there that primarily is probably actually better suited in the first instance by being taken care of by your loved ones, by your communities, with the help of those who are close by, rather than what we're seeing increasingly now, which is that the only way to get the acute help that you need when you reach those end stages of life, unfortunately, is to often call an ambulance. And far too many people end up spending their final days in a situation that they would much rather not have. So I'm focused on that. That's my primary focus. And so what needs to change? Well, actually, first of all, those incredible charities that do deal with this we know are underfunded. And it's just getting worse and worse right now, because for a lot of charities, they are really suffering at the moment. And I do think that there ought to be a dedicated service within the health and social care ecosystem, although I would struggle to say exactly where when you look at the spider web of what the NHS looks like these days, but that it ultimately is part of that integrated, community-focused NHS that we talk about as Liberal Democrats, one that puts the individual at its heart. Because if there is ever a moment, for me anyway, that I want to know that someone is receiving the care that they want in a way that they want, the ultimate choice, that is the time that we have to make sure that they have it. Because if you don't, there is no other chance.
Thank you, Layla. Ed?
I think our country is nowhere good enough on palliative care. Care when people are terminally ill, pain relief. And I felt this for many, many years. I mentioned during this campaign that I nursed my mother when she was terminally ill. I was actually by her bedside when she died. She died in Nottingham General Hospital. I was on the way to school at 15. It was in the morning. I was by her bedside. She was knocked out with painkillers because she suffered from a particularly painful form of bone cancer. I used to administer morphine to her for the last year. And what was horrendous about that experience, which you can imagine has stuck with me till now, is she was on a dementia ward. So some of the elderly ladies, God bless them, were screaming, running around the ward, and my mum was dying. And I know, having gone to hospices and seen really good palliative care, that needn't have been the case. Okay, it was back in 1981. But I just don't think we do enough for people who are dying, or their families. We don't give them the quality that they deserve. And one of the things I've done in the last 2 years is I've been campaigning on care, terminal care, end of life care for homeless people. Because you want to look at the group in our society who really miss out on palliative care, it's homeless people dying on the streets in pain, in agony. And surely, as a party that cares, surely as a society who wants to treat people with respect and dignity, we should make sure that people, when they die, whether it's homeless people, whether it's mothers with young carers, that they get that dignity, they get that pain relief, and they are properly respected at that moment of parting. So I feel pretty passionate that we need to do a lot more on that. When it comes to whether you support what might be called voluntary euthanasia, I've always had my own personal doubts about this. I know it's very controversial. I know the majority of population would vote for it, but when it's come up in Parliament over the years, I voted against it. Not for any religious reason, but from my own experience. It's a long debate, a long discussion. I hope for our party it will always remain a conscience issue, because I think it should be a conscience issue, not because of religion, but because of it's very, very personal. It certainly feels very personal to me. And given that we have got such a long way to go to give people choice with palliative care and real respect, I think, let's focus on that. That can unite us and bring us all together.
Thanks. I'm just going to read out a question now from Jenny Stratton. It's around private companies and their involvement in the NHS. So Jenny asks, one of the results of the 2003 NHS reorganisation was that local NHS services were competing with private companies for contracts. What are your views on private companies providing, for example, integrated local facilities? So overall, just looking at private sector involvement in the NHS and or the care sector. So Ed, if you could start off, please.
Well, I think our party policy, which says very clearly that there should be no longer a legal requirement to tender out a service, is the right way to go. Because I think then local health managers and local community have got a much freer hand to work out what is best for their local people and their local community, and take account of the many different options. But whether this is a question about saying there should never be any private involvement in the health service or not, I'm reluctant to go down that route to exclude all private companies or private individuals, not least because from the very start, there have been private contractors, GPs, who have been right at the heart of the NHS. And if a company can provide a service that's better, that works in a strategic way, that actually is a better value for money and provides better care, and crucially doesn't undermine the network of the health service in that local area or that region, then I don't have an ideological problem against that. I want us to explore, though, as a party, the mutual sector. Let me give you an example from my own constituency. Some time ago, our primary care trust, which was providing a lot of the primary care service, physiotherapists, speech and language, district nurses, and so on, 450 professional employees, they were put into a different organisation outside the NHS, but it wasn't private. It was actually owned and run by the employees. Amazing organisation called Your Healthcare. So a mutual employee-owned model, locally based, locally accountable. And it's been fantastic for improving both the quality of care and the amount of care, because they massively reduced management costs and put it back onto the front line, not into the pockets of shareholders. So I give you that example because sometimes this debate, we allow this debate in our party quite wrongly to be hijacked by Labour and Tories. It's a public versus private. No, it's not. There are other types of models out there. I can show you one in my constituency. I was very much involved in making it happen. Really proud of Your Healthcare. And I think those models are quite interesting for Liberal Democrats. And I think it creates much more diversity in a way which can improve the services for the patient, which ultimately is what we're about.
Thank you, Ed. Leila?
Thank you, Jenny, for this question. And actually, these kinds of issues, I would argue, is one of the reasons I won my seat. We've had two of them recently, one before the 2017 general election and one more recently in the John Radcliffe. And the one that was part of the 2017, well, actually there were two. So one was the Abingdon Community Hospital itself, as part of the sustainability and transformation plan, was under threat of being closed. And as part of that plan, there was a whole host of retendering that needed to happen. And one of the areas that then came out of that, now luckily we managed to save the community hospital, we got it taken off the table, absolutely, with quite a lot of political pressure. But they were looking to make savings, the CCG, who, by the way, were at the time very unaccountable And it really is interesting to me how it matters so much how good the governance is of clinical commissioning groups, and also trusts themselves as to how democratically accountable they want to be. Some can just shut up shop and have no interaction with their local councils and indeed their MPs, and some actually take a very good view of it. And I've seen it from both sides. And what happened in Abingdon was the physiotherapy services were tendered out. They did a tender, as they have to now under the changes. And what happened was that a private company put in a lower bid, or quite often what happens in these cases is that the private company is just better at writing the bids. And they did that. And lo and behold, a poorer service emerged. And then my post bag started filling up with people who very often were post-operative, who desperately needed these physiotherapy services in order to get reintegrated back into society and back into their own lives. And heartbreaking stories of them not being able to access the services, or those services having been moved and them not being able to do it. And then more recently, we've been fighting, and this is at a different level, not the community level, but actually at the regional level, the privatization of the PET CT scans that run in John Radcliffe Hospital Trust. And what happened there was that actually the John Radcliffe were giving a gold standard of PET CT scanning services. And when it was put out to tender by NHS England, which incidentally, the CCG itself had no idea that this was happening, there was no coordination. It took me about 2 months with a rigmarole of letters to all sorts of different people to work out what on earth was going on and who was responsible. And I think this is one of the problems with the NHS at the moment, is it's very hard to know as a layperson who you're meant to go to solve a problem. But we did get there, again, through massive political pressure, through being on the phone all the time to the heads of these trusts, the head of procurement at NHS England and so on. We did manage to actually, in the end, even after they'd put it out to tender, awarded the contract, then found a way for, and this is just bizarre, the private company then recontracted back to the NHS so that they could still deliver that gold standard service. And what those stories, I think, illustrate is how ridiculous a situation the NHS is in now. And it explains, in my view, why we end up with this creeping privatization. Because the NHS itself, at a time when, we've spoken about it before, social care workers, healthcare workers, lack of beds, lack of resources, all sorts of pressures that they're seeing year on year, more complex needs. The NHS itself is under increasing pressure. And yes, more money has been put in, but frankly, it's not even enough money to keep up with the demand that they're seeing. And on top of all of that, you then have these tendering processes, very often done not in a way that puts the clinicians first, but actually in a way that's putting business people first. And it's the private companies that are putting in these tenders that then end up getting rewarded. And who is the one who suffers? The patient. It's always the patient. So my view is, let's start with the patient. If they are receiving a high quality gold standard service, that's fantastic. If the NHS and the CCG and whoever it is wants to carry on giving that service, and yes, there needs to be checks and balances, but by and large, those services are utterly fantastic, brilliant. But we shouldn't have the situation where these services are forced to be tendered every single time, because otherwise that leads to this creeping privatization. It needs to be stopped and ideally reversed.
Thank you. I'm now going to move on to coronavirus, the post-coronavirus era. And my first question on this is a slightly niche and possibly quite controversial one for Liberal Democrats. And that's just around vaccines. So in some countries, some US states, vaccines are required in order to use certain forms of schools or certain public services or certain nurseries. In the UK, if hypothetically we had a COVID vaccine, a coronavirus vaccine, should that be made compulsory? So Ed, if you could tackle that first.
Well, there's different ways of encouraging people to take a vaccine, as we know. Let's remember, to my knowledge, and you're a Dr. Mohsin, you may know better than me, I don't think we've ever had compulsory vaccines in our country. We've always had an approach which is voluntary, but where there's been a huge public education and push and support. I think that I'm right in saying that. And I think we need to go down that route rather than mandatory. We might need to back it up with some reserve powers, however, and reserve measures. So, for example, you might say that unless you can have some sort of certificate that you've had the vaccine, you can't use X or can't do Y. And that may be, frankly, because of the public health needs, more important. Let's face it, a lot of the vaccines we've had in the past have not been with respect to very infectious diseases, as I understand it. Again, Dr. Mohsin, you're the doctor, and that might be distinctive about this particular vaccine. So we may need to go further than we have in the past. But I think the real skill for government, and this government probably doesn't have the skills. Let's face it. The real skill to government is winning over public trust. And so when we get to that vaccine, we're going to have to find a way, and we need to be pushing the government to find some sort of independent body that has some trust of people to try to persuade and get that public education out there. So at the moment, I would fight shy of it being absolutely mandatory by law, but I would want to look at those measures which would, because it would be very difficult for someone to proceed and do different parts of their life unless they'd had the vaccine, that would give an extra incentive, an extra push to going down that route.
Thank you, Ed. Leila?
Thank you. My instinct is to say that absolutely we should not be forcing anyone to take vaccines. But that said, I would also want to recognize that there is a growing movement of anti-vaxxers. It is very, very, very bad. It is based on fake news. It is very often actually stoked through all sorts of nefarious influences on the internet. And it's incredibly dangerous. And we are seeing year on year an increase in the number of parents who are refusing to give their children vaccines. It reminds me very much of when there was that link to the downsides of taking the MMR, which were completely discredited afterwards. But the problem with online is it's much more hidden than it used to be. And the answer, of course, is education. It is also reassurance from government. And there is also an incredible pressure that should be being put on people like Facebook, on Twitter, that they are beginning to respond to, but frankly, they aren't doing enough of it yet, to make sure that wherever this kind of dangerous fake news, because if people aren't taking these vaccines because of ill-founded misconceptions that in some way they are unsafe, then actually it's not a personal choice. It puts everyone else at risk. And I think that idea of personal choice versus other people is actually the conversation that we're having here. The thing about vaccination is that, as you know, and many know, you have to reach a certain level in the population for us to protect each other. And that is a sort of herd immunity that you can achieve with these vaccines. When it comes to coronavirus, given the way that it is actually locking people's lives away. In the inquiry hearing that we had this morning, we had 2 hours of hearing this morning, there was a phrase that was used by one of the public health experts who came on, who are on independence age, which is that in essence, because of coronavirus, we have now created a kind of age-based apartheid. There are people in their 70s and above who are living a completely different life than, frankly, people my age, who are quite happy to go out and when we're in supermarkets, certainly wear a mask. But there are very many people who are very, very worried, quite rightly too, because we are not at zero COVID transmission. We have not got to the point where public trust is in the government, and I can understand why they feel that way. And so we need to get everyone vaccinated as quickly as possible. By the way, I'm so proud of Oxford's Jenner Institute, of Sarah Gilbert and her team. I've been in contact with them. They are absolutely incredible. And I would be so proud if that vaccine was from Oxford, but I don't really mind where it's from, so long as we get it out there as quickly as possible. But we have to first recognize that there are these people out there who are going to be pushing for people to not have to take it. And we need a minimum level in the population to take it as quickly as possible. The third thing I just want to mention is another concern that has been coming up a lot recently, which is that much of the services, many of you may have recognized this yourself, if you're calling up your GP at the moment, it's not services as normal. And if you are going to be having vaccines, if it's going to be delivered by or through your GP, at the same time that we need to start bringing screening back on stage, cancer checks back on stage. People are currently not even going into hospital when they are having heart attack symptoms because they are either worried about coronavirus or worried about overwhelming the system. Then we've got a second wave potentially coming with the winter flu. My concern, my real concern, is that even when these vaccines are created, that we aren't going to have the capacity in the system to actually deliver them as fast as we possibly can. So there's a whole host of issues there. But bottom line is, I don't think that it should be something mandated by law, unless we find ourselves in a position where the anti-vaxxer movement is so huge that we have to. But I don't think we're there yet. I think we can tackle it in different ways first.
Thank you. So just looking at how we prepare for future pandemics, we've obviously learned a lot about the mistakes, some understandable, some not so understandable, that the government's made over the last 6 months or so. How and what should we change about how we prepare for pandemics in the future, and also for other major health crises such as antibiotic resistance or other things that may come up as major health risks? So starting with, so just working out who's next, sorry. I think it's Layla next and then Ed.
Thank you. Well, this is a very topical question, Mohsin, isn't it? Because over the last 48 hours, we have seen Matt Hancock say that he wants to roll up Public Health England, suggesting, of course, that it is in some way an arm's length independent body, which it never has been, and has always had direct line of sight to and from the Secretary of State. The buck does in fact stop with him, and I'm very, very concerned about the way that he's trying to blame game Public Health England at the moment. But as a result of this, it has raised some interesting questions about how do we manage public health generally and the role of public health in society. And we have today in the inquiry done a specific session on test and trace, but actually 2 sessions ago we were looking at this in the broader sense, and there is a consensus developing about what needs to happen. Bluntly speaking, if you look across the world at countries that are doing this well, they are countries that have put a lot of resource into public health bodies, and there are many different aspects to that. It could be testing and laboratory space that isn't as centralized. It could also be expertise. A really stark piece of evidence that we heard today was every time that you have a reorganization of some public health style body, you lose 20 to 30% of the senior management. And the concern at the moment is, where are these people going to come from? Many of them have retired and we haven't replaced the pipeline, and they have been doing an incredible job over the last few months. But the other side that has been coming up time and time again is that the more locally driven this is, the closer that they are to the ground, the better the information flows. And there's a whole host of issues around the way that information is flowing through the system that's causing a bottleneck right now. But bluntly speaking, the more local it is, the better it is. And that is what we are seeing in various ways. Germany has a system that is far more devolved to the local level, and so they're doing it that way. And then there are countries that are very technologically advanced, and this is what's happened in South Korea and others, where they have an app that has essentially localized it and allowed for that very local aspect of it, even though it's more centralized. And I would like to see us in the United Kingdom move to a system that is far more local, far more joined up, one where we have sorted out these data flows, one where we recognize that actually the best experts to know how to tackle public health crises are the ones closest to the people affected by those public health crises. It's a very similar mantra to what we say about democratic accountability and localism, and it really, really works. So I do think that there is a narrative that is developing around this now. I have absolutely no faith in Matt Hancock or Dido Harding. I would much rather have seen a head of this service that was head previously of test, not talk. But unfortunately, we are where we are, and it would seem that cronyism is alive and well in the Tory party. So we'll have to see what happens next. But the general point around public health being important, it being well resourced and well localized, I think is the one that we should be pushing for politically at the moment.
Thank you, Leila. Ed?
To be honest, Mohsin, I don't know. I want to see a lot of studies and analysis on this. And while we can have some instinct about where we may need to go in the future, I think this has proved such a catastrophe, both in people's health, in frankly the UK's shambolic handling, and the impact on our economy, that we need to make sure that we really get this right. And that's going to need a little bit more study than I'm afraid I've been able to do. But there are some things that I think we can say will need to be put around this. First of all, when you do simulations of crises, in this case pandemics, as the government did do in 2016, I think those reports should be published and people should be held to account for implementing them. Because if the Cygnus exercise that was carried out by the government in 2016, if it had been implemented, we would have been in a far, far better place than we have been. Because the Cygnus exercise talked about more PPE, it talked about more ventilators, it talked about more critical bed staff. And so therefore, that's the first thing. If you do preparations and you go through simulation exercises and are supposed to learn some lessons, and implement the bloody thing, make it transparent. And we really need to have done that, and we need to do that in the future. So that's the first thing. The second thing is we have to work internationally. I mean, do we not realize now that these pandemics are international? And the fact that Donald Trump pulled money from the WHO is a scandal. And I just hope, one of the many reasons I hope Biden wins is that we can get back to proper international cooperation, and our own government, the appalling approach it's had throughout to working with our European allies because of its Brexit ideology is a disgrace. And we should be, as the Internationalist Party, talking about international cooperation on so many things: early warnings, sharing best practice, sharing early lessons, working together on vaccines, etc., etc. So, good preparation, internationalism. And then I agree with Leila on localism. So many of the mistakes the government have made is because they think they know best. They think Whitehall knows best. And they've ignored help from the private sector, from local government, from communities, from charities. They've just ignored people. I've had so many examples of people wanting to help and being shut out. I've had so many examples of nationally provided support, from food parcels to testing regimes, that have been hopeless, where when local authorities have been doing, or communities have been doing it, it's been really high quality. So I think there needs a cultural change here. And as Leila said, it doesn't just apply to thinking about future pandemics, it applies across the piece, as Liberal Democrats know better than anything. We've got to have much more vibrant local democracy where there's power, there's resources, there's responsibility, so you can get the joined up services locally. So I'm going to finish there. I'm going to finish where I started. I'm not absolutely sure. We do need to study it in some detail, but preparing better and being more transparent, international cooperation and local solutions look like the sorts of things that will be in that better package for the future.
So I'm now just going to move on to public health in a slightly more broader sense. Thinking in part about how coronavirus has changed how we have to think about things. So first of all, just looking at things like transportation, how we get around our cities, how we connect our rural areas to our urban areas, how we deal with things like public transport, which is something that historically we may have bigged up, But now we also face the issue of making sure that people are not crammed in high density in really tight areas, and also how we might change bits of public health and transport policy in a world where we are all working more from home, some of us. So just to start off around that, what are your views on how we can adjust, change transport policy, urban design policy with a public health view? So I'll start off with Ed.
Well, I don't want to sort of repeat the last answer in one way, but in a way it's a bit too early to know, because do we know how many people are going to go back to offices? Do we know how many businesses are going to completely reorganize themselves? Say, hey, it's okay. You can still have productive workers who are working at home a lot of the time, and we can organize our office space differently. And we just don't know the answers to that, you know, Mohsin. I think we've got to do a lot of research pretty quickly and think that through. There is a period between now and when it will become a real question, by the way, when the vaccine hopefully is used, because if we have a vaccine, you know, some people might argue you can go back to status ante. I don't think that. I think even when we have a vaccine, the way that our public transport systems were operating, the way that we had not allowed people to work from home more was a bad thing. And our party has long argued for more home working. And so I hope we can keep some of these more useful things that have come from COVID. And then if people are willing to do that, if business are willing to do that, if the public sector is willing to do that, if it can work, then we may have to rethink transport in a profound way. I speak as an MP who represents a commuter seat, in the sense that in my seat in Kingston and Surbiton, we have 10 train stations, one of the most busiest outside a major city. And I don't know exactly the proportion, but it's a pretty high proportion of my working age constituents travel on the trains every day. And as someone who's used the trains to go to Westminster for the last 20 plus years, you know, go at peak time, they are extraordinarily crowded. Now, just imagine if every person who works in the city now, on average, they work 1 day a week at home instead in the future. That's a 20% change. That's dramatic in terms of transport planning. And so if anyone knows the answer to what's going to happen, then they're a very clever person. I don't think we know. And that creates some real challenges, because we clearly don't want in the interim people all to go into the car. Now, fortunately, a lot of people are still traveling at home, so you know, it's all balancing out. There's a lot more people walking and cycling, and that is all fantastic. But knowing the long-term implications of this for transport policy in particular, I think are really hard. Indeed, commercial office premises and that market, very, very difficult. Even on thinking about housing, what happens if we don't use or don't need 20% of the current commercial office space in our big cities? What's going to happen? Is that going to solve our housing crisis? I don't know. But I just give you that example because these are really big questions. No one can possibly think they know the answer to them, but we've got to get to the bottom of that. And if we do, we could do it in a way which is great for greening our economy, good for people's health, good for family life. There's lots of things that we've argued for a long time. So I hope the party can fizz around this and really get some good thinking going. And on the policy lab platform that I've sort of with the FBC encouraged, I hope the party can really start debating these outside for formal processes, so we can come up with some really interesting thoughts about how post-COVID we think about things like transport and planning and housing.
Thank you. Leila?
Well, in terms of thinking ahead, I mean, we know that the government is absolutely terrible at this, and we see it over and over again. And yes, Cygnus was one very good example of even when they do start to think just a bit ahead, they then don't even listen to themselves. And one of the things that I've been trying to do in the last few months is to get the party to start thinking about some of this. So some of you, and Mohsin, thank you very much, you contributed to, we pulled together a book called Build Back Better, Britain After Coronavirus, Lib Dem Policy Ideas. And in there were some really interesting ones. And one in particular that actually comes to the heart of how do we plan for things like this, is actually to have a department in the government whose job it is, a unit in government, whose job it is to plan for the future, plan for these worst case scenarios, plan for what happens if, because then when we have situations like this, and by the way, this home working, working from home, working flexibly, a lot of these conversations were already being had in the context of artificial intelligence and automation. And actually, what we have seen with coronavirus is an acceleration of much of the change that many people had already predicted was going to be happening anyway. But the problem has been, because we're not prepared for it, we are already starting to leave some people behind. A very good example is that bus services aren't running. There are some parts of the country, in my own constituency, literally at the end of my road, there is a school and there is a bus that connects one of the villages to the school. And for the elderly people who live in the village, it's their way of getting into town so that they can go see the doctor. By the way, it's the only bus that goes to the local doctor's surgery. It's also the one that goes to the post office, where they will collect their payments and pensions and all the rest of it. And that bus is now no longer viable because there aren't enough of the students to use it. And as a result, parents are scrambling around, and I had a meeting with the bus company, had a meeting with the parents, had a meeting with the parish clerk of the village, so that we could work out together, how do we advertise that actually we could essentially private hire this ourselves and find a way to get funding, and people are now going to have to subsidize it to keep these buses going. And that should never be the case, because it's the young, it's the elderly, it's the disabled, it's them who, through what we're going now, are the ones who are most likely to be left behind. And I fundamentally believe in public money for public good, because what happens if you don't ensure that they are a part of our communities? Well, you lose them, you lose their incredible contribution that they would otherwise make. You lose, actually, for many elderly people, that sense of independence. And we know that loneliness costs as well, in terms of mental health, but also in terms of their physical health. And then there's a knock-on effect on other parts of the NHS. This lack of joined up thinking drives me mad. And so this is the kind of thinking that I do think people want political parties to be talking about. Through coronavirus that has exposed these issues, we can build a better Britain. We can do things differently. And I think there is a case to make the positive case for it, because a lot of people just want it to go back to how it was. But I don't want it to go back to how it was, because how it was a society that was excluding disabled people. It was a society that had loneliness in it. It was a society that had deep-rooted inequalities. Coronavirus has exposed all of this, has shown us what is in front of us. It's held up a mirror, and the worst thing that we could do now as a society is to not change as a result.
Thank you. I'm now going to move on quickly to mental health and well-being. And my question is firstly about young people. Young people have gone through a lot this year, disruption to school. We've seen in the last week or two, huge disruption to higher education and their plans for the future, and also just general disruption to their plans overall for life. What's our message and our vision to them around mental health and well-being as Liberal Democrats? So I'll start with Leila, please.
Thank you. Well, first of all, even before the pandemic, mental health was one of the top areas that young people that I was speaking to. And I self-styled myself when I first got this role. I was a teacher. I was a maths and physics teacher for well over 10 years before I was an MP. I was the first head of year that was 21 in my very first school. I've always had a pastoral role. I've always taken a very personal interest in this because actually you can, as a teacher, affect someone's life forever if you just sometimes take that time to listen at a moment where they are telling you that they are suffering from anorexia, as has happened to me in the past, or they are depressed or whatever it is, and you show them that someone's there for them, who is willing to listen, and then you help to signpost them to get them the help that they need. And it's actually those moments in my teaching career that I value the most. And what we've seen with university students over the last few years is an increased awareness of how poor mental health provision is for young people. When I sat on the Public Accounts Committee, I helped to lead an inquiry into children's mental health. And if you think mental health is a Cinderella service of the NHS, then children's mental health is the Cinderella service of the Cinderella service. And what we have to say to them is that we believe in a mental health charter for universities. It was something that Norman was pushing. I've been working with my local students' union on this because it is so incredibly important. And Mohsin, you are absolutely right about the strife that this incompetent government has caused young people, not just A-level students who are going off to university. Today's big mess is that apparently Gavin Williamson tried to resign. Boris Johnson said no, Lord knows why. And since then, Gavin Williamson has now said that apparently it was Ofqual who changed what they were going to do with the grades, and he knew nothing about it. I mean, this man is completely incompetent, and I've been calling for him vociferously to go. I've also been calling for Boris Johnson to come back off holiday and personally apologise. But none of that's going to be enough. What we also need is a massive increase, an injection in resource into the CAMS service. And in fact, there are some who say that it's so broken it needs to go completely. I've always thought that there needs to be better mental health provision in schools. We need to make sure that there is enough teachers in schools so that you can do that pastoral side, that side that I said still is the most rewarding part of being a teacher. You often can't do in most state schools because there is such pressure on your time that it's the first thing to go. And so overall, what we need is better resourcing, but also a change of approach, an approach that's young person centric, where they are put first and their mental health and their well-being matters as much as how much money they're going to go on and make in the future and what grade they're going to get. I want to see a schooling system that puts far less stock on a single number and a single digit, and absolutely strive for high quality education where everyone achieves. But does it really have to be as clear cut as one single exam on one single day when you might be having a stressful day? There is something seriously wrong that's happening at the moment that is leading to young people feeling more and more like they cannot cope. And it is one of the great pandemics of our time that we are not seeing, because this is across the world. So I want to see the Liberal Democrats lead the charge on putting mental health and well-being back at the heart of what schools are for, that social and emotional development is just as important as intellectual development. And for those who are thinking about what happens next, whether it be university or whether it be trying to get into a job market that is disproportionately unhelpful to young people right now, we need to be the party on the side of young people so that we can win back those voters, many of which that we lost during coalition. This is our moment for us to say, we're on your side. Think of the Lib Dems again, start voting Lib Dems again, because we will make things better for you.
Thank you, Layla. Ed?
This has to be a top priority for us. You know, I'm really proud of what people like Nick Clegg, Paul Burstow and Norman Lamb in particular achieved on mental health in the coalition. It's a really proud record, but since we left government, the Tories have completely messed it up. And it's got worse even before COVID. Now it's an absolute catastrophe. And let's remember that because this affects young people so badly, it can scar them for the whole of their lives if we don't get early intervention. And early intervention is a dream at the moment. If you look at the waiting list for most child and adolescent mental health services, come to my constituency, some people are waiting a year, 2 years, 3 years to see a consultant. It's unacceptable. So if we want to actually almost save a cohort, we have got to make this a priority, and it's got to be urgent. And that's, yes, that's cash. We've got to get the staff in. Maybe, you know, all these people that the Tories were turned away with their Brexit and their immigration controls, we're going to have to see if some of them would come back and support us in our mental health services. You know, this has to be a priority. And there's so many individual things. Yes, early intervention. But one area that I get very concerned about is the transition of young people to adult mental health services. People get lost in the system. And that's really got to be improved, because that can be very, very dangerous. A student mental health charter that the lady mentioned, that's absolutely critical. There's a lot of evidence that when young people go to university for the time, sometimes they don't fit in, and sometimes they feel alienated, and they are very, very vulnerable. So we've got to identify those vulnerable points in people's lives and act. I'm worried about the increasing unemployment. Lots of evidence over decades that people who are unemployed can, for the first few weeks, they can be ready and up and wanting to fight and get another job, and then gradually, as it's so difficult, then they get into depression, and it makes their unemployment almost impossible to escape. So early intervention, those critical points, is so important. And we, given our proud record, need to be the champions of standing up for all those sort of changes in services, changes in resources, that are the only way that we can recapture the people's lives and make sure that the mental health problems that they have don't become ingrained and something that just scars their whole life. It's so important, and I think this is an area that we can champion.
Thank you. I'm now going to move on to my final question before the closing statements, and that's a bit of a mixture of a question, because I've had quite a lot of questions around topics of ensuring equality within healthcare and of tackling discrimination. So I'm going to ask, what are the key areas of equality, tackling discrimination within the healthcare system that you think we really need to address, and what are the ways to go about that? So I'll start with Leila, please.
Thank you. Well, this is quite interesting in the context of coronavirus, because I think we are beginning to see now that actually the NHS itself has very often discrimination built into it. And I have given the example before about Black and minority ethnic doctors in particular being more likely to be on the front line, but also being less well equipped for in the NHS at the time of coronavirus, where masks either don't fit or they've been asked to be moved elsewhere, and they are worried about it affecting their careers. It's hugely discriminatory. But then separate to that, there have been reports, I think it was the BMA, who had spoken about actually inbuilt discrimination in the NHS as a whole, where it is far less likely that a Black doctor would be promoted, where there is microaggressions that happen all the time. They're far more likely to be complained about. I mean, this is just atrocious. And we have to recognize that that discrimination that we're seeing as part of Black Lives Matter exists in our own NHS. And as a result, it then feeds into people's view of the NHS. To be a doctor, it's something that we want to encourage people to do, and yet more and more and more we're hearing that people are finding it stressful, and even more stressful when you face elements of intersectionality, and if you're part of a minority group, it's utterly unacceptable. But there are a couple of other areas that come from the other way around. We know, for example, that when they do tests on medicines, they tend to be done, often for ethical reasons, more likely to be done on men than they are on women. We've seen very high profile cases of medicines in the last few years where actually the way that a woman would metabolize a medicine is very, very different to a man, that it has in fact been used in courts of law, because whilst you might give the same dose for the same body mass index, actually the way that it would then translate into a woman, they argued, caused them to be drunk-like, and that explained why they created the misdemeanor. I mean, nevertheless, the point is that we do have discrimination in the health sector against women, and that needs to be addressed. And the other area that absolutely needs to be addressed is one that has been blowing up over the last couple of years, and that is discrimination against the trans community. Whenever I have spoken to people from the trans community about this, they tell me that they will often go to a doctor who has absolutely no clue about how to signpost them to the right place, very often, in fact, they try and tell them that it's not really a thing, that there's nothing they can do. They are either ill-informed, or even worse, signposting them to the wrong place, or even worse, making them feel small. And this is an area that desperately needs looking at. Technically, under the Equality Act, this shouldn't be allowed. And yet more and more we are seeing that this is happening, and it's being reported. And I think the answer to this, bluntly, is that this needs to be something that's taught in medical schools. My understanding is, and correct me if I'm wrong or if it's changed recently, but actually these kinds of issues of discrimination are not taught actively as part of medical courses, and aren't something that people have to undertake extra training in. I would like to see that change, and I know that there are industry bodies that are calling for similar changes as well.
Thank you. Ed?
Well, I want to start first of all with Black and minority ethnic people, because I think COVID has shown something very significant, but it's something that we knew was there before. We've known for a long time. I was particularly taken with a report by Roger Klein back in 2014. I think it was called The Snowy White Peaks of the NHS. And Roger Klein made the point in that report that the NHS is the biggest employer of Black and minority ethnic staff in the UK by some mile. And he pointed out how the number of senior managers in the NHS who were Black and minority ethnic was tiny in proportion to the number of staff and in proportion to the wider population. And he's come up with a whole set of proposals that have been around on the table for some time now that have just not been implemented. The government and the NHS has not taken this seriously. That has to stop. And if Black Lives Matter protest doesn't matter, if it doesn't make it happen, if the scandal around how BAME staff have been treated during COVID doesn't make it happen, we have got to make it happen. This is a disgrace. And you know, people have lost their lives. People are increasingly not treated, have not been treated well for many a year. And it's got to be at the top. It's got to be at every board level. You know, every board of every NHS organisation has to have equality, diversity, and inclusion as part of its core business, both for Black and ethnic minority staff, but for everybody. LGBT plus, women, disabled people. Age discrimination is an issue. Vince Cable did a lot of campaign on age discrimination in the health service. So there's a lot of issues here. I think that the Black and ethnic minority issue stands out because of the way the NHS, and indeed the care sector, let's not forget the care sector, of course, is such a big employer of Black and ethnic minority people. But I think it goes more widely than that. So I hope our health and social care policies will pick this up. Under my leadership, they absolutely will. We have, as a party, to live our values and speak our values. And we are a party that believes in equality and diversity. We've not been anywhere near good enough internally, but we have, and that absolutely has to improve. But when we talk about things like the NHS and COVID, we have to show that we get it and we're serious about being the leaders and the proponents of real radical change.
Thank you. So I'm now going to move on to the closing statements from the two candidates, and these are going to be in the reverse order to the opening statements. So this is for 2 minutes each. So Layla, you'll be going first, and then it'll be Ed. So if you could start off.
Well, thank you so much, Mohsin, for so ably chairing, and thank you all at home for watching. Now more than ever, we need a strong liberal vision to challenge the Conservatives and move our country forward. We need to put patients and those who need our care and support at the heart of our public services. And we need to build on the work of people like Paul Burstow and Norman Lamb to finally put in place a long-term framework for social care for all who need it, and ensure that mental health is given top priority. But we also need to do much more. to help those who we rely on to help us, and give our social care and NHS workers the pay and conditions that they so richly deserve. But to change our country, we must first change our party. We are on 6% in the polls. Steady as she goes just won't cut it. We can and we must do better. We must develop a strategy and a vision and a message that grabs headlines and rebuilds the party's profile, explaining to people what liberalism is. But we also, if we're going to do that, have to live our values. We rightly call for mental health to be given top priority in public services, but what do we do for our own members? And whilst, of course, delivering 10,000 leaflets can be an extremely helpful thing to do in a campaign, actually our members have different skills and support that they can offer. We need to put well-being at the heart of our organisation too. Because to deliver for people in our communities, we need to be a party that starts winning again, so that people can see on the ground why it makes a difference to vote Lib Dem. Because when you vote Lib Dem, then you get Lib Dems. And when you get Lib Dems get things done. We need to rebuild trust in our party. We need to reinvigorate our party. And we need a leader that voters can believe in. I am that leader. So please, if you haven't yet cast your ballot, please vote for me and let's move forwards together. Thank you.
Thank you, Layla. Ed?
Thanks, Mosin. I hope I've shown you I have the vision, experience and judgment to lead the Liberal Democrats. And I hope I've shown you I have some understanding of NHS and care. Friends, the campaigns ahead will not be easy, given the huge challenges facing our party. As the Thornhill review into the general election showed, things aren't good. There are no quick fixes. There never have been. But the core message of the Thornhill review is that the party must stop talking to itself and start talking to the voters. Our priority campaigns must reflect the concerns of most voters, must be relevant to their many worries. And even before COVID, health and social care were top of their list. If I'm leader, they will be top of our list too, built around a new strategy on care. For me, care is personal. A young carer for my dying mother, the main carer for my wonderful Nana when she became elderly and frail, and now a carer with my wife for our severely disabled son, John. I know about caring, and I know how critical the NHS is to families in trouble. So I'm determined we get this right and campaign hard once again on the NHS and social care. I'm an experienced campaigner. I'm the only MP in our party's history to win without being a target seat. I've won 6 of the 7 elections I fought in a seat we had never, ever held before. I know we can win. Yes, while times seemed tough after December's disastrous election, I remember the first nationwide election 11 months into Paddy Ashdown's leadership. We scored 5.9%. But I also remember how Paddy led our rebuilding by campaigning hard, by winning elections, winning by-elections. We can return to winning ways. So please join the likes of Shirley Williams, Daisy Cooper, and Munira Wilson. Please back me to be the leader. Thank you.
Thank you very much. So I'm just going to close this this session, this hustings, by first of all thanking the 2 candidates for giving up their time to come and take questions from myself, from members and others, and offer us their views on health and social care as we go into this, as we come into the closing part of this election. Just a reminder that we are literally in the last week and a half of the election. So do remember to get your ballots in by the middle of next week if you haven't already. And I'd also just like to thank the staff at headquarters, led by Jack Coulson, who have helped me with this hustings today. Thank you, everyone, and have a good, safe day.
Thank you, Mohsin. Bye, everybody.
Thank you. Bye. Bye-bye.